All right, we are live. Hello, Facebook. Happy May. We are so excited to be here with you again for this month's episode of Milk Minutes. My name is Ashley, and I'm filling in for our normal host, Camara. And today, our guest is Healthy Start's own Demia Tyler. She is the Director of Strategic Initiatives for Healthy Start. And today we're going to talk about navigating through being a breastfeeding professional, because we know when we have the babies and we start nursing, for most of us, it's time to go back to work at some point. So we kind of just wanted to talk a little bit about that. And Demia, who is a new mom and is literally living this part of her breastfeeding journey. So I'm really excited to be able to talk with her about that. Demia, how are you doing today? And welcome to Milk Minutes.
Thank you. I'm excited to be back. I'm doing really well. I'm feeding the baby right now. I could not make this up. He just was hungry now, so gotta feed him while working.
That's the way it goes. So without, taking up too much time, we can get right into our questions. So the first question that I have for you is, being a working mom and breastfeeding, it's basically another job on top of your work. So can you talk a little bit about your experience as a new mom and how you've been managing doing both?
Yeah, I just have to say, I'm incredibly blessed. Obviously, I work for Healthy Start. We have the Healthy Start Center for Urban Breastfeeding. So I'm really lucky that I have a workplace structure that really supports and promotes breastfeeding. But that doesn't mean that it's not a challenge, because just like right now, when he wants to eat, he wants to eat. And so sometimes I got to take a pause and be like, hold on, y'all, I got to go off camera and feed the baby, or I'm a little late because I'm wrapping up feeding. And, we've transitioned to kind of a hybrid model. So we have in-person meetings. Those are so much fun because there's so much prep that goes into bringing all of your pump supplies and stepping out on a regular schedule in order to pump and store your milk, making sure that the location that you're meeting at has a place where you can store milk effectively for whatever the period of time. So there's a lot of moving parts that go into it. Mommyhood is fun. It's a lot of problem solving, which is right up my alley. But specifically the breastfeeding part, it just adds another layer of coordination that, I have to do in order to make sure that he's fed, whether he's with me or not.
Almost forgot I was muted. Yes. Oh, it is a lot. And you are kind of diving into my next question. And I agree, being at Healthy Start and breastfeeding has been in its own way a blessing, I'm sure. And so recently, Healthy Start received a designation for being one of a breastfeeding friendly workplace. And so can you talk a little bit about, you kind of got into it, the benefits of having an employer that is friendly in the workplace when it comes to moms who need to pump?
Yeah, I mean, there's so many ways that a workplace can support a mom who's breastfeeding. For us, that looks like, our work is hybrid, and so he's home with me. He's able to breastfeed on demand for most days. When we're in person, there's some meetings I can bring him with me to, but also, we have pump space in the office. We have our Center for Urban Breastfeeding. We have a fridge, and those are things that aren't specific to Healthy Start. Any workplace can have a room that is sectioned off just for breastfeeding. We recently had a meeting at the Hosanna House, the Allegheny County Health Department, and the Hosanna House set aside a room for us to go in and breastfeed and be able to pump. They set aside space for us to be able to store our milk. So any workplace can make sure that there's private space for someone to be able to feed their baby. Those are just some of the benefits that we have access to at Healthy Start. So that's a benefit to me because I'm able to continue to work, and I want to work. I love my job. I love what I do. And if I didn't have this support, it would be choosing between changing how I feed my baby, which this is my desire to feed my baby in this way, or not working, which really isn't too much of an option for me. So I'm excited to have those support so that I don't have to make that choice. And that choice has repercussions for the employer too. So
Yes, so I'm going to skip over to another question because we're kind of in this space about employers, and I think that's such a huge factor that sometimes employers may not think about. How when we provide that access and space for nursing parents, that creates a more comfortable work environment. So can you talk a little bit, one, as an employer, you have staff, you have team, what those benefits are for the organization when we create, safe and comfortable spaces for our staff to be able to breastfeed?
Yes. So I just recently took a training, a professional development training, and in the training they said that it costs about a third of an employee's salary to be able to replace them. And so that means that in order to, if somebody's making $100,000 or $90,000 to replace them, it costs that employer $30,000. If someone's making $60,000 to replace them, it's costing that employer $20,000. So it costs you money to have to replace that breastfeeding parent because you couldn't set aside a room and make sure that she had a private space to pump. It cost you money because you couldn't purchase a little $130 mini fridge so that there was a place for her to store her milk. It cost you money when, especially for positions where it works, you're not willing to extend a hybrid model to your employees. So employers save money by making sure that these benefits are available to families. And then there's just the long-term benefits. Babies are less likely to get sick, and so that employee doesn't have to call off work as often, possibly. And then there's the health of the mom as well. Breastfeeding parents benefit from breastfeeding as well, and so there's that workplace savings as well. So there's lots of savings to the employer, contrary to popular belief.
Yeah, and a happy employee makes for a happy company and a happy
Mm-hmm.
organization. So I really love how we lead in our work and discussing that and showing people, it's basically you give an example that it works. And it allows people to just have it's like a load lifted in a sense. So my next question, you are a CLC, also known as a certified lactation counselor. And so you have been able to support a lot of moms on their breastfeeding journey. So can you share some advice for our breastfeeding moms and families? Because I know for me, although I'm the one that is actually breastfeeding, our family can also be supportive of that. So can you talk about that and entering back into the workplace?
Yes. So specific to workplace, some advice that I would give, the first piece of advice that I would give is as soon as you know that you're expecting and that you plan to breastfeed, if you plan to remain at that employer, you want to familiarize yourself with the workplace accommodations. Bigger employers, there is under the ACA, there is a requirement that you get breaks in order to be able to pump. If you're a breastfeeding parent. So just checking to make sure, does your employee even acknowledge that? Does your employee fit into the category that has to abide by that law? So that would be the first step, checking in to see what the supports are and how they would fit into your structure. The next step would be talking to because maybe there's not anything formally, but your boss or supervisor might be able to extend some supports to you. So making sure that you have that conversation with them when the time is right. And then once you're in it, it's a lot of prep, especially if you're going in person and you're going to be pumping. So identifying what pump you're going to use. When I go in person and I'm not going to have him with me, I plan the night before. I'm like, okay, I have my pump pieces. My pump is charged. I'm probably going to pump around this time and this time. It fits within the agenda that I received in this way. So that planning really helps to kind of take some of the thinking, the real time thinking, because I already have it planned. I know exactly what I'm going to do, when I'm going to do it. And another thing is, and this is where family comes in. If your child is going with family, making sure that you have enough milk for him for that day or for them for that day. So that's another part of planning. How many hours are they going to be there? How often do they eat? And approximately how many ounces do they take per feeding, and making sure that that's what you're sending. And then, oh no, and possibly a little bit extra. You okay, Buddha Butt?
Gotta love live in action. It's like we are
Mhm.
literally showing how this happens.
He's falling asleep now.
The
Yes,
see, the good
yeah,
liquid gold.
exactly. So yeah, just making sure that you plan ahead. Planning ahead is really all of it. Planning ahead while you're pregnant, for what your workplace accommodations look like. Planning ahead when you're leaving them with someone. It's a lot of planning.
Yes, and so I kind of want to dig a little more in questions with the planning your milk for family and for people who are going to be keeping your child. One thing that I know I experience sometimes is that our milk varies in time. So sometimes you've got to have conversations with your family about, don't worry about what it looks like. The milk is good. Feed my baby. So do you want to talk a little bit about that?
Yes, luckily I haven't run into that, but that is a conversation that you definitely have to have with family ahead of time. That, and also the feeding schedule. Like, when he's doing this, make sure he's fed. This is his schedule. This is how he shows that he's hungry. I think that if a family member isn't familiar with like what it looks like to breastfeed, then they might think that the baby's not eating enough, that the baby needs 5-6 ounces. Why are they just eating this 3 to 4 ounce bottle? So just reassuring family that like breastfed babies sometimes eat more frequently but less. And so, yes, smaller amounts. So just making sure that family is aware and educated about that, so they're not trying to sneak rice into your baby's bottle before that's something that you comfortable with. So it's all of
No.
those points of education.
Yes. And the last thing that I want to ask, because I think this is just a good thing to mention when we're thinking about family, is pace feeding. And a lot of times people don't know what that means. So can you also
Yes.
talk about pace feeding for us before we wrap up?
Yes, that's a really good one. So that with bottles, there's the nipple hole, and you hold the bottle upside down, and the baby drinks it really quickly. With breastfed babies, they tend to pace themselves because they're at the breast. They could be there really long. They take their time. And so when you're bottle feeding them, you want to kind of mimic that experience. And so rather than just having a bottle up at a full 180-degree angle, you want to try to like kind of angle it a little. I can't even think of the angle right now. Angle it less so that they have to work to get their milk. They're drinking it at their own pace, and that's why it's called pace feeding. So it's not just burling down their throat. They're actually actively transitioning the milk from the bottle nipple to their mouth, because it mimics what it's like to breastfeed. And so especially early on, if you're breastfeeding early on, if you go back to work early, that's really important, because it helps to prevent nipple confusion. And then it also helps to so that they don't get lazy on the breast because they didn't have a bottle. So that's really important. Later on down the line, the babies get used to like the transition between the two, but early on, pace feeding is so important.
Yes, it is. My mom, she breastfed me, but she only did it for 3 months because she had to go back to work, and things weren't like that clearly back in the 80s. But that pace feeding was just so new. And I was like, let's make sure we can capture that, because we want people to know that it's nothing new. It's just a technique that's really important. So I really appreciate your explanation about pace feeding, because I was a big on pace feeding with people when they had the babies. I'm like, y'all not gonna mess up our flow.
Mm-hmm.
So this was great. Do you have anything or any last words that you want to share for moms who are nursing and as they're preparing to go back to work?
I'll say that, sometimes it can feel like a lot, but you could do it. There are a number of supports if you just need encouragement, or if you need some tips on how to prepare. There's the, Healthy Start Center for Urban Breastfeeding, of course. You can call with any question you have about breastfeeding as a Black woman in Allegheny County. And then there's the Pittsburgh Black Breastfeeding Circle. So there are a number of places you can go for support, but you can do it. And remember that any amount of breastfeeding is good for your baby. Any amount of breast milk is good for your baby. So for as long as you can sustain it, do your best. And you're doing great, moms.
Yes, thank you so much, Demia. And like she just said, the Healthy Start Center for Urban Breastfeeding provides lactation support, education, advocacy, and outreach to Black women in Allegheny County. And you can contact any of our certified lactation counselors, also known as CLCs, by calling us at 412-545-2022. You'll select option 1, and the line is open from 6 a.m. to midnight. So we are here for you at Healthy Start. We want you to have the most successful experience as a breastfeeding parent, and we're here for you. So thank y'all so much for tuning in to another episode, and we'll be back again next month on the 4th Monday at 6 o'clock right here on Facebook Live.